Hello and welcome to the Work Wellness Institute conference, exploring the reality of inclusive return to work. Before we get started, we would like to gratefully acknowledge that we are joining you from the traditional, ancestral, and unceded territory of the Coast Salish people, including the territories of the Musqueam, Tsleil-Waututh, and Squamish nations. We would like to take a moment to thank all of our funding and presentation partners for their support. Great to see we have people here from not only all the provinces, but other countries as well. That's amazing. Awesome, welcome. All right. It is now my great pleasure to introduce your host for the event. Dr. Cameron Stockdale is an executive leader who has been researching the intersection between leadership, change management, and strategic planning for over a decade. He has worked in a variety of different settings, including more than 25 years in the healthcare field related to ambulance services and home healthcare support. For the past 2 years, he has been the president and CEO of the Work Wellness Institute, an organization whose focus is to research topics related to occupational health and safety to create healthy, safe, and inclusive workplaces for all workers. Please join me in welcoming Dr. Cameron Stockdale, President and Chief Executive Officer of the Work Wellness Institute. Welcome, Dr. Stockdale.
Good morning here in Vancouver, and thank you, Heather. I would first of all like to thank you for joining us here today at the conference talking about the importance of inclusive return to work. As mentioned, I'm Cam Stockdale, and I've had the pleasure of being the CEO here for about 2 years. And I'm really fortunate to work with a group of people here at the Work Wellness Institute that have put this program together for you. So I think starting out this morning, I'd like to say thank you for them. I know the hard work that has gone into this. It's been amazing, and I think that they put together a really interesting program for you. As many of you know, our organization was founded in 1985, and our current goal is to turn research into practice, creating safe, healthy, and inclusive workplaces for all. We do this by working with stakeholders, multidisciplinary stakeholders. Many of you here are at this conference today, and they come from both the public and private sectors. And our goal is to create and share the latest research on work wellness and turn that into practical, useful tools. So our intention from a knowledge mobilization perspective is to be that credible hub of information, and that's why we're here today. If you go to our website, you'll see many of our current projects, which focus on mobilizing knowledge and resources that work towards reducing barriers to employment participation and opportunities for people living with disabilities. The Work Wellness Institute Conference Series, which this is the first one of, is a call to action to bring intentional focus to the kinds of workplaces we want to create and return to after the pandemic. This global pandemic has obviously created some exceptional challenges for us as employees and our organizations. But through it, I think we learned that we can adapt by coming together and sharing information. At the same time, the pandemic has caused us to face some inequalities in the workplace, exposing our vulnerable populations to the disruption of events like the pandemic and the need to create workplaces that really support our people. From our perspective, everyone has a role to play in building culture that leverages a diverse viewpoint, eliciting new insights, and creating sustained value for organizations. So this requires a commitment to removing systemic barriers that often remain too high for many people that we work with. It's against this backdrop that we invite you to participate in our conference series, where you will be invited to reflect, think critically, and learn from experts in their field. Thus, the goal of this conference, to harness the talent of the people here at this conference. And when you return to your workplaces, you will become a catalyst for cultural change. And as we move towards reopening our economy and our workplaces, businesses must consider how to make return to work for everyone. As we've seen, return to work in this environment is complex and has a number of considerations. And we need to start thinking about things like employee well-being, their fears and their stress, the legal considerations, the consideration for vulnerable populations, how we communicate and collaborate between stakeholders, such as our employees, our employers, or specialists that work with us. And frankly, how to accommodate people in our organizations. And I think that's why our first session is so important. We've named it Return to Work, a broad picture. We've brought together a panel of experts to provide a holistic picture on returning to work. And they're going to bring their multiple perspectives, including the impact of remote work and return to work on employees, particularly those with disabilities, tips and guidelines on how to plan a safe and collaborative return to work, the challenges that we all have with the return to work process. We all have new policies with respect to COVID-19, and we'll discuss some of those, and obviously occupational health and safety considerations. With that, it's my pleasure to introduce Maureen Haan, who will be moderating the event. Maureen, as a friend of the organization, has done a lot of work for us in her role, but she is also the president and CEO of the Canadian Council on Rehabilitation and Work. She's extremely active in the cross-disability sector, focusing on employment issues. And she has been involved in numerous committees, boards that increase awareness of and access for the disability sector. So with that, I'll hand it over to Maureen and say thank you very much and enjoy the conference.
Thank you, Cameron. Thanks very much, everybody. And it's wonderful to be here. I always enjoy these, any type of information session that the Work Wellness Institute puts out. I always find them extremely engaging and informative. And today is no different. So it is my great pleasure and honor to introduce our first panel today. Dr. Rebecca Gewurtz. Her research focuses on work disability policy, income insecurity, and employment among people living with disabilities, with a focus on mental illness and other episodic disabilities. Our second panelist today is Fergal O'Hagan, who is a registered kinesiologist, academic, and researcher who has practiced in the field of occupational rehabilitation with a range of clinical populations for 25 years. And our final panelist is Stephanie Cousineau, who has spent her career helping others envision and create meaningful employment experiences. Previously as an academic and career development coach, and now as a labor and an employment lawyer. We're going to hear from each of these panelists one by one, and then following that, we will have a panel, an open panel with a Q&A. So I really encourage you, as Heather was asking you, to type your questions in the chat box, and we'll have a very interactive time together. So with that, I'm going to turn it over to Rebecca. The stage is yours.
Thank you. I'm just sharing my screen now. So I'm really excited to be here to talk about some of the work that we have been doing, as well as some of the work that we hope to be doing in this area, because I think this is a really important area of research that is up and coming, and that we can learn a lot from all the changes that have been happening during the pandemic. So today I'm going to share bits and pieces from different projects and initiatives that we're working on. And if you want more information on anything that I talk about, please do not hesitate. I'll share my email at the end, and I'm happy to discuss as well. So as background, we know that, and this would predate the pandemic, that work from home can address many barriers that have been traditionally experienced by people with disabilities. And in fact, prior to the big pandemic, it was often positioned as an arrangement that could address many of these challenges, including the need for privacy among people with mental illness, transportation challenges, and those who need regular rest periods to manage their condition. There is a difference in the literature from before the pandemic versus since the pandemic, because now that work from home has become more widespread, and certainly now during the pandemic, we have an opportunity to consider the impact of remote and hybrid work arrangements on the experiences of people with disabilities. So the objectives that I'm going to talk about in the next little while is to really identify some of the unique work challenges people with disabilities are facing during the pandemic. I'm going to describe the impact of remote work and hybrid work arrangements on the experiences of people living with episodic disability and some of the work we want to do in this area, and identify what can be learned from our experiences with remote work during the pandemic. So as I mentioned, I have spent some time in the literature, and remote work, work from home predates the pandemic, obviously. And it was really part of the transformations the technological transformations that have been happening in the workplace. In the literature prior to the pandemic, there was a lot of talk about the barriers that are removed for people with disabilities through remote work opportunities. It allows, and it also allows for more flexibility. But traditionally, that literature, the pre-pandemic literature, did not really clearly distinguish between different work arrangements on the experiences of workers. And now there's really an opportunity to explore that a little bit more. So with the pandemic, with COVID-19, there was a dramatic and sudden change in how many people work. Jobs that have traditionally been labeled as you have to come in person, there's no flexibility with this, were suddenly pivoted to being remote. And I think there's a really important opportunity now to take stock of what we can learn from how that transition occurred, and what works well and what doesn't work well. So how can needs be accommodated while working from home? What remains unmet? And how can we take this learning and utilize it to carve out the future of work in Canada and internationally? Cameron mentioned, what kind of workplace do we want to return to? So how can we take what we've learned from this, sudden change of work from home and use it to inform that future workplace that we're trying to build, that and ensure that the needs of people with disabilities and this concept of inclusion and accessibility is front and center as we reimagine, the workplaces of the future. So when we were doing when the pandemic hit, we were doing some research on homelessness and the experiences of people who were homeless and had transitioned to housing. So when the pandemic hit, we had to sort of dramatically or suddenly stop that data collection because of our focus in that research was on boredom, and we really felt like the pandemic really changed that concept, and we didn't want to have a cohort effect of before and post and after the pandemic. So we stopped collecting data on that project, and we started as a team to think about COVID-19 and low income households. And we were having discussions at that time about how this capacity to pivot really required people to have some resources. It required people to have financial resources as well as devices and technological resources. And, certainly not everyone had those options. So we decided to collect some data on the experiences of people in low income households during the pandemic. And what I'm drawing on now is some of the data from that work that focused on employment. So just to describe that sample, although we weren't specifically sampling around disability, there were high rates of disability and service use in that sample, partly because of the way we recruited. And among that sample, although many people were working, some people didn't have the option of working from home. So working from home was certainly unevenly distributed in that sample. What we did is we conducted an online survey in May and June 2020, and 111 people completed it. A subsample of the survey participants were invited to participate in qualitative interviews in June, July 2020. And then we really wanted to look at the experiences over time. So we repeated the survey 3 times every 3 months. And we also did a follow-up interview approximately 6 months to 9 months after the first interview. Sorry. And again, this research wasn't specifically on work and work from home, but I've extracted some of that data. And some of the findings that might be of interest is certainly people experience job loss. There was a lot of concern and stress about what was going to happen. There was talk about equipment and workspace for those who were now working from home. There was discussion around social support and how people communicate and communication issues, and then access to broader supports to stay well. So one of the issues that came up in our data was this idea of job loss during the lockdowns. Now, I should mention that this data was specifically Ontario low-income households. So those of you who are from Ontario know that in 2020 and 2021, Ontario had a series of lockdowns. It happened multiple times. And there was certainly discussion about this loss of identity and meaning, this missing of employment, and frustration about this inability to return to work and what return to work would look like. And certainly a sense of boredom and lack of activity was reflected in the data. So one of the quotes from one of the participants was, "My work isn't simply a way of paying the bills," really capturing that loss. There was also a sense of worry and stress caused by those who were still working and working in high-risk jobs or areas that had suddenly sort of become high risk and frontline. There was a lot of worry about potential work mishaps created by the pandemic fatigue or fog, and anticipation of what returning to work would look like and what that would be. So a lot of talk about that stress and that concern. And again, I should mention these quotes are from the follow-up interviews because that's what's on my fingertips right now. And so this is really data that was collected only a few months ago. And then this idea that work from home can be challenging. So as I mentioned, prior to the pandemic, work from home was often described as the solution. But here we see discussion of some of the challenges that come up for people working from home, especially those who are in low-income households who really don't have the capacity to create a suitable workspace for themselves. So this quote, I think, really captures a lot of that sense. So you cannot work from your couch. You cannot look at a dining room table and make this a long-term fixture. Sooner or later, you get problems. So this idea that you need a proper workspace and you need capacity to build that. And then here, I think we're getting, again, back to that work from home requires you to have a home and to have a home with space or room for work. And the inequities and the capacity to have that. So all these people who are able to stay home and do these really good jobs and all that stuff, I think are in the minority. These are probably people who have very good income from their employer, very good home, somebody to look after their kids. That kind of idea that not everybody has that capacity. This particular picture, I'm going to admit, is from my own home, not my workspace, but you can see there's like a recycling bag in the background, there's garbage all over. But but what is seen by colleagues is actually this. So you can sort of see how people cover up the chaos in their work environment. And then another thing that came up that I think is really important as we envision the future of work is this idea that some things are just better in person. We really need to think through and identify what can be done online, what makes sense to do remotely, and then what really does require that in-person connection, and what kinds of benefits we get from being in person. Again, I think some of this is going to be sector and organization specific. And we know that many global organizations have always had these global teams working together, but there is a need to really to dig down and say, like, when do people need to connect in person and what can continue to be remote in the future? So as I sort of wrap up my component of the panel, I really want to put out there this, what I think is the $1 million question around, what is the future of the work that we want to return to? Is it a return to in-person work? Is it a continuation of work from home, or is it some sort of hybrid? And what is possible within each organization? What is best? And what is feasible? And what can we learn from this experience to foster that inclusion? So when I think it's really important that we take stock of how people accommodated or didn't accommodate their disabilities in the context of remote work, and how we can learn from that as we return to whatever the new normal is going to be. So what can we learn? I think one thing that is for sure is that we have learned that many jobs can be done and can be done well remotely. So this idea of, well, that job can't be done remotely to accommodate a disability is probably no longer valid. That many people with disabilities, I think what we've learned over the last, almost 2 years is that many people can accommodate their own needs in work from home arrangements. But we've also learned that certainly there is often something that is lost when people work remotely, and that the capacity to work remotely is not equally distributed among workers, that there are inequities in the experience of working from home among people with and without disabilities that do need to be considered. So certainly there's more to come. We're continuing to work with this data, and we certainly are hoping to do more research in this area and really leverage everything that we have learned in the last 2 years that can help inform the workplace of the future, and ensure that that we create a workplace. We would create workplaces that are inclusive and accessible for diverse workers.
Thank you so much, Rebecca. That's just awesome. So now we'll go over to you, Fergal, for your presentation.
Well, thanks for attending the panel today, and thanks to Work Wellness Institute for organizing it. My name is Fergal O'Hagan. I'm currently an associate professor in the Department of Psychology at Trent University, and having had a long career in occupational rehab, I moved more into research and academic role over the last decade or so. And one of my main areas of research is focuses on factors enabling and constraining return to work following sickness absence, including how we can best get stakeholders singing from the same book. So in terms of the agenda, I'm going to start by providing a case example and use it to help illustrate how the challenges in the challenges that we can face in the arena of return to work in terms of communication and collaboration. I'm going to discuss some of the strategies that have been researched and developed to improve communication and collaboration. And then I'm going to talk about some current research that we're doing on communication and collaboration during return to work. So I think the main take-homes are first that communication and collaboration occurs across a complex network of stakeholders. And these are situated in different systems through a range of media. But the barriers to effective communication and collaboration are not just media-based, but differing interests and perspectives around the work disability situation and the path to sustainable return to work. And so improving communication and collaboration requires that we integrate stakeholder systems through media, but also recognize a shared purpose and the importance of collective effort, perspective taking, and an integrated approach to return to work. So let's talk about a case example to get the ball rolling. And Judy, who's more or less representative of participants in my research, experienced a work disability as a result of a cancer diagnosis and subsequently had a car accident that caused significant soft tissue damage. She's mid-career, in her 40s, and married with young adult children. And in her case, when she went off work, her insurer balked at the benefit claim despite healthcare provider information supporting it. And Judy had made the HR and Occupational Health and Safety Department, who handled return to work in her workplace, aware of her intentions to return to her position. She didn't contact the employer any further, and her employer didn't stay in contact with her. Unaware of her intention to return, her supervisor posted her job, and it was taken by a coworker without Judy knowing it. Her union wasn't made aware either of the situation. And so when she went back to engage in return to work, her job wasn't available. Once made aware, the union intervened, her position was made available to her. She made a successful return to work through a graduated return to work program. Following this, her cancer condition reemerged. She had to go back off again on sickness absence benefits. Having learned from mistakes on her first episode, she remained in close contact with her employer in this instance, and along with her healthcare providers and support from her insurer, a successful graduated return to work was planned and executed. So Judy's case, I think, illustrates the complexity of return to work. And when we consider sickness absence, it's important to consider the context that Judy's sickness absence plays out in. Because of the sometimes contentious nature of return to work, the return to work situation has been likened to an arena with the worker at the center of the intersection of separate but sort of interrelated systems. And of course, the worker has their own system of personal supports, family, friends, but surrounding the worker are the workplace system, the healthcare system, and the insurance system. And each of the systems plays a respective role in either maintaining or reducing work disability through various functions they play. And each of these systems has distinct cultures that includes ethics and attitudes and practices, including communication. They have different rules that are either explicit or implicit that govern activities, and this can create tensions across systems. So for example, the ethics of patient care prohibits healthcare professionals from sharing information freely about a worker's health status, which sometimes frustrates workplaces who want to understand the situation. And each of healthcare, the workplace, and insurance are not homogeneous entities in themselves. So they're populated by different actors who have their own beliefs and behaviors about sickness absence and return to work. And within the workplace, for example, supervisors are concerned with productivity, while union reps are concerned with the health and rights of the workers. And the actions of these actors happens within a larger legislative and social context, which Stephanie's going to talk about. Under human rights legislation and compensation regulations, employers are obliged to accommodate workers up to undue hardship. So some of these tensions were evident in Judy's first disability episode, where the insurer discounted information from healthcare providers and refused to provide access to supports that may have helped Judy return to work earlier. And in the workplace, information transmission broke down between HR and her department. In the first episode, both Judy, the disability insurer, and the employer took a passive stance with respect to communication. In the second episode, contact was maintained and resulted in a more timely return to work. So I just ask you to think of a more complex system for anything to play out in. And when we, Judy's case, I think, also illustrates the multiple channels for information exchange and engagement. And you have interactions between employers, workers, compensation or insurance representatives, potentially a return to work coordinator. In terms of form and media communication between actors, communication can be direct, but it's often indirect. Workers are often the conduit of information from healthcare providers to the workplace and vice versa. Form-based exchange is the common medium used to transmit information between healthcare providers and workplaces, and they're efficient, but they are often limited in the extent to which they can communicate the kind of nuanced information that's required for work accommodation. And we also get a sense of the dependent nature of the return to work process. So each of the actors involved produce different forms of information necessary for return to work. And each of the actors is dependent upon that information to properly fulfill their role. Work is also distributed across actors in the system, with most work being done asynchronously. So with information being transferred indirectly and directly, the web of communication, I think, is inherently vulnerable to miscommunication and misinformation. And also evident in Judy's case is how information has to move across separate systems. So these systems have particular communication practices and use different media. So for example, a high proportion of communication in physicians' offices still takes place through fax, while workplaces are using state-of-the-art systems like MS Teams or Slack for exchanging information. Also, another dimension to consider is that communication and collaboration is timing. Interaction between stakeholders needs to be both timely and at the right time. And work disability proceeds through different stages that require different actors to be involved at different intensities and for different purposes. So at the beginning of the sickness absence, you have early involvement of the employer, healthcare providers, families, the insurer. As rehabilitation proceeds, you see engagement of healthcare providers, the exchange of information around progress and functional abilities forms. And then during return to work, you have intense involvement of workplace parties, supervisors, co-workers. Those actors, they do a lot of invisible work when it comes to return to work. And you potentially have ongoing healthcare professional monitoring in the situations. So not surprisingly then, we see frustrations expressed on the part of workers and other stakeholders. And these quotes are from my research on communication and collaboration during return to work with different stakeholder groups. As you can see from this worker's experience, workers are often caught in the middle between differences in views and mistrust among stakeholders. And of course, implicit in this insurer's response to the worker is a lack of trust, not only for healthcare providers, but for the worker. As reflected in this employer's experience, employers are frustrated with healthcare when healthcare providers overstep their bounds or don't stay in their lanes and try to dictate accommodation, which is the responsibility of the workplace. And when you talk to physicians, as this physician states, physicians are constrained by their resources and their abilities and recognize the limitations in determining workability. So, to sum up, communication and collaboration not only relate to the structure of forms, but on knowledge, trust, abilities, and resources of actors involved in the process. So what has research demonstrated about improving communication and collaboration? I'm going to touch on 3 areas: integrated approaches, facilitation or orchestration, and improving communication channels. So let's start by looking at integrated approaches. So integrated interventions bring actors together to form an integrated rehabilitation team that connects the healthcare setting to the workplace. And early research on return to work provided evidence for the value of creating such teams. In the 1990s, Patrick Loisel in Quebec and colleagues conducted trials in Sherbrooke where they randomized workers off on short-term injury absence to usual care conditions compared to purely clinical rehab programs, compared to programs that involved the workplace and integrated the workplace with clinical care. And the results demonstrated clear superiority for involving workplaces in return to work and rehabilitation and return to work. And on average, what Loisel trials showed was that workers return to work about 2.4 times faster than the usual interventions. And this research has been replicated over time and in different populations. So the figure up here is from a Dutch study published in 2010, where they compared an integrated program that included rehabilitation and workplace intervention for chronic pain patients. And just to orient you to the graph here, time to sustained return to work is indicated across the bottom. And the percentage of patients off on work disability is indicated on the y-axis, or percentage of patients having returned to work. The red line is the integrated care and the blue line is the usual care. And apart from the significant difference in overall return to work rate, you can see that integrated care resulted in a quicker return to work. And more recently, researchers in Norway combined work-focused cognitive behavioral therapy with workplace-based intervention in workers off on sickness absence owing to depression and anxiety. And despite the generous compensation system in Norway, workers are entitled to a year of full pay when they go off. The program succeeded in returning workers to the workplace faster and more often than usual management. So just looking at the figure on the right here, the intervention group is the red line. The usual care group is the blue line, and it doesn't appear to be much difference, but it was statistically significant, and I think something, a bit of a feat in a system as generous as that in Norway. What about facilitated approaches? So facilitated approaches, what I'm referring to here, are approaches that facilitate collaboration between actors. So usually, often involving a return to work coordinator. And so the research closer to usual practice has demonstrated the value of facilitation to promote return to work. So using this simple model of three-way communication, researchers in Sweden trialed setups where the rehab coordinator meets separately with the worker and supervisor, and then together with them to assess and eventually plan and enact a return to work with the goal of establishing a shared plan. And they called this meeting a convergence meeting. And the graph here shows time across the bottom and percent return to work after the convergence meeting on the y-axis over here. So the red line is the communication intervention, and the blue line is the usual management. And this intervention demonstrated a greater return to work, 87 versus 73% over the first 80 weeks of follow-up in the workers sick listed for stress burnout, compared to similar workers involved in the system. And longer follow-up, over 180 weeks, revealed an advantage for younger but not older workers. And I think what really impressed me with this intervention is the effect observed for the amount of effort put in. In a follow-up study, the researchers contacted managers who had been involved in the program, and they expressed greater feelings of competence and the ability to make adjustments and interact with sick listed employees. And, you know, I think these are outcomes that we seldom look at, and they speak to the value of such interventions outside of the effects on return to work. So, you know, this is tough work, and providing managers and others with knowledge and skills that will allow them to do their job, not just better, but also with more confidence and comfort, I think is important in their work lives. I think a word of caution is warranted, though. Some of these studies are conducted in systems with very different setups than most of us operate in. In European jurisdictions, there's no element of causal qualification for sickness absence. Return to work falls within a larger welfare support system with prescribed stakeholder rules and actions. So it's very different from our multi-insurer disability systems. What about improving channels? So channel improvement interventions are focused on improving information exchange through media. Myself and one of my graduate students looked at prospects for advancing communication and collaboration through communication tech innovation. We were working with a group that was developing an app that had features that enabled information development, transmission, and decision making. For example, the app incorporated a standardized database on disability duration to provide normative information on disability durations by diagnosis. And in this research, we had 24 members from different stakeholder groups, so injured workers, physicians, rehab therapists, and employers respond to a demonstration of the app and the idea of using IT to improve return to work communication. And what we found was that, you know, folks generally had no objection to the larger idea. They found the app acceptable and useful. I mean, workers wanted their privacy ensured, but at the same time, they were practical at recognizing the amount of health information that was already electronic. Physicians needed the system to mesh with their electronic medical record systems. Employers were enthusiastic about such an app, but cynical as to whether it would be used properly by physicians. Stakeholder objections were more from an implementation standpoint, and all stakeholders around the worker believed that it was necessary to have systemic buy-in for any such technology for it to work effectively, and they were reluctant to get on board before others did. And there's other efforts to develop apps that I'm aware of, including a research poster at this meeting, so we'll need to stay tuned on this. In terms of current research, I'm going to quickly mention some research that we're conducting, focusing on communication and collaboration during return to work. We're using a questionnaire and focus groups to look at interaction patterns between workers and 11 stakeholders involved in the return to work process in Ontario and Quebec. And so far, we've conducted 14 of 48 focus groups with 6 different stakeholder groups. We've been asking about changes in communication during the COVID period. And just to give you a little bit of flavor of things, among the return to work coordinators that we've had in the study, most of them actually indicated that there's been little change in their communication pattern during the COVID period. There are some that indicate an increase or actually benefit in communicating with other stakeholders, such as workers, employers, and supervisors. And some indicate greater obstacles to communication, particularly with healthcare providers. So we have a research poster up in the conference space. Please take a minute to attend the research conference site, and we invite any employers, HR folks, managers, insurance professionals from Ontario and Quebec in the audience to participate in the project. So I could go on further. It's a huge topic, but I'll leave it there for now. I'm happy to answer any questions during the question period, and you can also get in touch with me through my email should you want further info. I provided a list of papers referenced in the talk, and some of these are available through open access. And if you're interested in any of the others or other resources, please feel free to get in touch. Thank you.
Thank you so much, Fergal. That was excellent. Really, really appreciate your presentation, and looking forward to the Q&A at the end of the next panel. Thank you. So our next presenter is Stephanie. Over to you, Stephanie.
Thank you. Good morning, everybody. I would like to begin by acknowledging that I'm actually in Victoria. So I'm coming to you. I live and work on the unceded lands of the Lekwungen, Songhees, and Esquimalt people. So major disclaimer on this one. These are always given whenever a lawyer gives a public talk, the whole "this is not legal advice" disclaimer, but that goes for like so much more value on this talk today, because the law relating to COVID breaks and to the workplace health and safety issues that I'm going to be talking about, this is changing so fast that it's always possible that things I tell you now could not survive the end of the day. If you need some help, don't just rely on this presentation. Absolutely talk to a lawyer. This is an outline of what I'm going to talk about today. I've specified this as being return to workplace because I'm not really talking about a return to work, the RTW that is used to bring people who've been on leaves back to work. I'm trying to broaden this up and talk about what this is going to be like legally as people stop working from home and start to return to the workplace. So to talk about that, we'll look at occupational health and safety, work stoppages and dismissals, and changes to the workplace. What sorts of things are potentially available for you if you're an employer? So occupational health and safety is at the heart of almost all of the developments in the COVID work world. Employers fundamentally have a duty to provide employees with a safe workplace, and that includes complying with WorkSafe BC's COVID policies and guidelines. And my apologies to people who are not here from BC. This is obviously very BC specific. I live and practice in BC, so I'm aware of some of the policies and laws that are in other provinces, but if you were to question me on them, I will almost certainly not answer those questions. So it was because of occupational health and safety that those of us who could started working from home, or we masked and we distanced at work if we weren't able to work from home. Now we have widespread availability of vaccines, which offers a new component to health and safety. Just last Friday, November 12th, the Chief Public Health Officer of Canada issued a statement about COVID and called vaccines, quote, the essential base layer of immune readiness and protection, end quote, while masks were called, quote, an essential top layer against virus inhalation and spread between people. This was probably Dr. Tam's most Canadian moment ever. I love the way that she phrased that one. In this same statement, the government first recognized that COVID is aerosolized, and I anticipate that that could change the law. And that's kind of how things have been. If you know a labor and employment lawyer out there, buy them a coffee and give them a high five. It's been a really, really busy couple of months here. year and a half. It's been a busy time. COVID's been fun. So notwithstanding the perspective of anti-vax or vaccine hesitant populations, the vaccine did allow us to open up more safely. Back in June, the BC Provincial Health Officer, Dr. Bonnie Henry, moved us into step 3 of the restart. So that means that employers didn't have to have a COVID safety plan anymore. They could move to having a communicable disease plan. That's the sort of more generic policy, the same kind that would be used for the seasonal flu or potentially norovirus, those sorts of communicable diseases. But the Delta variant has proved a mighty foe, and it pushed us into the 4th wave, notwithstanding that we're trying to restart here. And so in August of 2021, again, Bonnie Henry took to the floor and talked about how, quote, the science is clear. When you are vaccinated, it means that you're less likely to get infected. If you're infected, you shed virus for a shorter period of time. You're less likely to transmit to other people, and you're much less likely to have a severe illness that leads to hospitalization. So she said this on August 23rd. That was after the mandates had been announced for healthcare and for long-term care homes. And since then, vaccine mandates have caught on more broadly, and increasingly they're spreading into private companies as a sort of a new normal. Like I said, this is all moving very quickly, and we don't yet know if there will be successful challenges to the vaccine mandates. Although, spoiler alert, yesterday I was at a human rights law conference where some of the panelists were discussing recent cases in BC. Some of them discussed cases outside of BC and the rest of Canada. And they're all kind of on the periphery. None of the decisions so far, there just hasn't been time for any fundamental, absolutely clear decisions to have been made yet. We've just got these little bursts of suggestions of what's likely to happen legally to deal with all these COVID-related changes. And so I would say that right now, it seems like there's a pretty good consensus that a vaccine mandate is probably something that an employer can introduce if they need to. And it's going to be different for labor depending on what kind of a collective agreement is in place. But like with any new policy, these vaccine mandates have to be done properly. And I would also say that it's pretty clear that a lot of these vaccine mandates will be challenged and not all of them will stand. If you, as an employer, consider that you've got a reason to make vaccination mandatory in your workplace, there are some things to keep in mind. There are privacy questions about the way that proof is being collected and stored. I'm not going to go into that in detail. It was an entire panel in the conference yesterday. I just want to acknowledge that privacy is a factor, and you should either seek some legal advice, or if you have a privacy czar already in place, just make sure that that person is informing themselves properly about what they need to do regarding the storage, collection of data, that sort of thing. You should also keep in mind that these mandates, to be compliant with the law, are also intended to be temporary. For as long as there is a public health crisis that requires this level of medical intervention for the greater societal benefit, that's the extent of it, not forever. There's also, excuse me, a narrow subsection of the population that could qualify for an exemption on human rights grounds. So that would likely include something related to health. If your physician were to say to you, you absolutely cannot be vaccinated, this is not right with your personal health, that's the kind of person who would be looking to apply for an exemption to any workplace vaccine mandate. And by law, you have to accommodate them to the point of undue hardship. And the Supreme Court of Canada used the word undue there very specifically with the idea that some hardship is okay. Hardship to the degree of, it takes some effort, it takes some reorganization, that's okay. But undue hardship could be something like, what if your workplace is a smaller workplace with 15 employees? Would you be required to create a whole new position to accommodate one of your employees? Probably not. That would probably reach the point of undue hardship. Absolutely get legal advice before you make that decision. Bottom line, it's just too soon to be clear on everything. Ask us in 5 years, we'll have a better sense of what you can and can't do, which I know is not very helpful. For right now, keep in mind that when considering a vaccine mandate in your workplace, the idea is that it should only be used in workplaces where, for employees to be effective at their jobs, the employees have to be in each other's company or client's company, around other people in close quarters. If your workforce is completely able to be effective in their jobs from home, that's probably not the kind of place that needs a mandate. So we have more and more people returning to common workplaces, but the pandemic is still going on. There's need for recognition of the fact that people will sometimes have to stop working or need some kind of a leave to deal with COVID-related issues. Employers should keep in mind that it's a good idea to have a policy in place for all of those things, things you've thought about in advance about what kinds of leaves and stoppages you'll be supporting, largely because you just want to make sure that your workforce can anticipate what could happen, what could be the consequences of their decisions. That's always the most important step to take. But to help you in all of this, the Employment Standards Act has been modified to provide some guidance about the kinds of COVID-related leaves, issues about things like, well, if your employee suddenly has to stay home because a dependent has COVID and they need to care for them, if they have to quarantine or isolate. These are the kinds of leaves that have been captured by the amendments to the British Columbia Employment Standards Act, such as Section 52(1)(2), which are unpaid, longer term in certain cases leaves. These are unpaid, but they protect the employee's job. And subsection 3 specifies that the employee can have this leave for as long as the circumstances that got them the leave in the first place exist. So something to keep in mind with long haul COVID sufferers, they could theoretically be on a Section 5212 leave, an unpaid protected leave, for a really long time. There have also been amendments at 121, 52(1)(21), and 52(13) that give some little incremental paid leaves in association with this. For example, the first 3 days of your Section 5212 unpaid leave would be paid if you meet the requirements, only until December 31st. That's written into the law right now, but it's pretty arbitrary, and I think it's very possible that that could be extended. You also get accommodation, you get paid 3 hours of paid leave to be vaccinated. I mostly just wanted to talk about these allowances, mostly it's Section 5212 that I wanted to bring to your attention here to talk about this unpaid leave, because while this is a legal leave, I get the impression that most employers think that what they can do when dealing with their unvaccinated workers and having a vaccine mandate in place, I get the impression that a lot of employers think that they can just put those unvaxxed workers on an unpaid leave if they don't comply. That's sure not the case. Too far. There we go. What I just outlined from the ESA, it lists certain circumstances that have to be met to get this unpaid leave. And in the ESA, that does not include didn't get vaxxed, couldn't do their job. The options that exist for employers to deal with their unvaxxed workers in a workplace that really does require vaccination, well, those options are a little bit limited. Employers cannot put employees on unpaid leave because unpaid leaves just don't really exist in the law if an employee has never had the chance to agree to that possibility. And by that, I mean, if you anticipated that there could be an unpaid leave, or if you were letting your workforce know that that's part of the stages of discipline, if there could be an unpaid leave in there, that has to be put forward to the employee for them to get expert advice, think it over, sign off on it. So what that should sound like to you is that if it isn't in that employee's employment contract, if it isn't in a collective agreement, it's not an option by law. If you put someone on an unpaid leave, you might have just constructively dismissed them, and you should absolutely be calling an employment lawyer. I would acknowledge, while I've gone through all this, there's no unpaid leave. I would acknowledge that if you wanted, and okay, disclaimer, this isn't a solution, it's kind of punting it down the road for future you to deal with. But in theory, you could, if you had unvaxxed workers who you wanted them to kind of come to Jesus, so to speak, if you wanted them to have time to think about it and to decide whether or not to be vaccinated, what there is available to you is an Employment Standards Act temporary layoff, which the Act describes or defines as being 13 weeks out of a possible consecutive 20 weeks. And during that time, the employee would receive less than 50% of their pay, so absolutely nothing would fit into that category. It is an option, this temporary layoff, it is. But what happens when you get to the end of 13 weeks and you haven't recalled that employee? What happens if at the end of those 13 weeks, the pandemic is still going and your vaccine mandate remains in place and this person is still not vaccinated? At that point, the law says, the Employment Standards Act says that it is deemed that that employee was dismissed at the beginning of the leave. So at that point, you'd be having to deal with, that's where I said you punted it down the road for your future self to deal with. 13 weeks later, it would be time to pay them the severance that they would be owed. And that is likely where a lot of employers are headed if they have unvaxxed employees and a vaccine mandate in place. It is likely that employers are going to have to be faced with terminating the employment of a number of their workers. That'll probably have an effect on productivity, possibly morale in both ways. And it can also have an effect on the employer's bottom line because the unvaccinated people do need to get paid out their reasonable notice. What can you reasonably do to maintain a safe workplace as an employer? Well, a good communicable disease policy that's enforced, that's not news. Before COVID, we still had communicable disease policies, and now we're just a lot more cognizant of making sure that they're actually truly enforced. It matters so much more now. You will continue to encourage hand washing and social distancing where possible. You'll encourage wearing masks. You might have a vaccine mandate, but after that, or possibly even before the mandate, if you're looking for alternatives, you do have a couple of options. One thing that is definitely not the same as vaccination, because part of the idea with the vaccines is that it reduces the severity of the illness should it occur. But to maintain a safer workplace for everyone, an employer could consider rapid tests. And that could let the employer catch an outbreak before it actually becomes an outbreak. There is a financial cost attached to buying these tests, administering these tests. Absolutely there is. And I did see one workforce trying to download that onto their employees, or sorry, one employer trying to download that cost onto employees. I don't think that that would hold up if that were challenged. I think that the Employment Standards Act forbids under Section 21, employers are prohibited from withholding employee pay. It also forbids downloading onto any employee the employer's business costs, and it's very likely that the Employment Standards Branch would consider that this is simply a cost of doing business, therefore it should stay with the employer. So these are some ideas that I've kind of talked about with other lawyers, but we don't know for sure. We don't make the rules. This is just what we think is going on at this time. You might also consider organizing a staggered office presence. So instead of a full return to the office, instead of having some people in on some days, or you could consider that, having some people in on some days and other people in on other days, instead of a full return to the office, you might also consider having staggered starts. So instead of having everybody come in at 8:30, you might have some at 7:30, some at 8:30, some at 9:30. So that way you would reduce the bottlenecks that force people into the same spaces at the same time, but you would have to manage this so that you didn't accidentally affect an employee's ability to provide childcare for their kids. That could actually end up getting you a human rights complaint on family status. So all of these decisions that seem really practical, they could have legal implications. Also because it could be considered that changing the hours that somebody worked, that can be a form of constructive dismissal. Although I think that constructive dismissal is more reserved for fundamental changes, and changing somebody's workday by 1 hour, and not arbitrarily, but because of this bigger public health issue that you're trying to mitigate. If you were to make a decision like that and stagger your workforce in that sort of a way, it's more likely that that would stand up against a challenge that would last. But I just want to highlight that if you start to put your thinking cap on and look for ways around having too many people in the same spaces at the same time, check in with your legal officer, your lawyers, what have you, just to make sure that you haven't accidentally crossed over into a line of what could lead you into a legal challenge or a human rights issue. So right now, bottom line is that it's just not all known. We're figuring things out as we go. Vaccines are helping us get back to life like we used to have. So our options have opened up in the last 4 months or so. But that doesn't change the fact that at the heart of the matter, we're still always talking about occupational health and safety and whether you as an employer are meeting your obligations. But this is a really hot topic and things are changing pretty quickly. I can't say that enough, obviously. I was reading on TED Ideas, which I think is a subsidiary of TED Talks. I was reading something that talked about 6 steps for navigating anxiety in the return to work. And that really just made me think that fundamentally, everybody would do well to remember that compassion, consideration, and calm communication will be really, really helpful here. I'm a lawyer and I can safely say that introducing law into most things amps up the anxiety and the stress. And last week I did a trauma-informed lawyering workshop where the instructor was talking a lot about how we are all still in a bit of a state of trauma relating to COVID and what's going on. So when in doubt about your legal, before jumping on lawyering up and getting aggressive, just always remember that we're all in this situation. And the first step to avoiding costly legal battles in the future is to make sure that you do practice sort of a calm, compassionate, considerate approach to all parties. And that's about it for me. So, yep, like I said, still not legal advice. You can find us out there on the internet. And other than that, I guess it's over to some questions.
Excellent. Thank you very much, Stephanie. We do have a couple of questions to start, and I want to thank you all very, very much for your insight and for your knowledge and sharing all of your knowledge and your background. It is it feels a little bit like we're trying to grab what we can of the knowledge so that we understand where the future is going for work for people with disabilities in Canada. So the first question is, I think that this one is probably more for Fergal, but anybody can jump in, of course. What measures could be adopted to facilitate engagement or use of digital return to work tools, in your opinion?
So what our experience in researching the app suggested that there has to be buy-in on the part of stakeholders, and we felt when we started researching it, we tried to get a test site, and we had a lot of difficulty doing that, and it was because people balked at, I don't want to be the first one here to get on board with this. So you have to have that minimal buy-in, and I think there needs to be a proof of concept. So it needs to be, and not just a proof of concept, here's an app, go use it. There has to be an actual proof of concept where the app is beta tested in a return to work setting, the situation. My plan had been to test it in a very kind of limited context. Work the bugs out, and because a lot of it, I think a lot of the bugs are going to be in usability. For example, with physicians, you need to get it integrated into their EMR. Otherwise, I think it's kind of a showstopper. So I think that engagement, you need to show proof of value and proof of usability. So that's what I would say.
Great, thank you. The next question we have is for Rebecca. Rebecca, I know your research isn't completed, but what have you seen so far that might support employees with a disability, including episodic disabilities, to be able to effectively work when remote?
So one of the things that we've been hearing, this is more anecdotal as we're, coming up with our research, has been that the regular rest, incorporating regular rest into their workday in a more flexible way is probably the most significant benefit of work from home. And I'm drawing on both what I've heard from anecdotally, and then also from the work that we did a few years ago for the Mental Health Commission of Canada around people with mental illness and different ways they are accommodated. So I think that capacity to have a flexible workday where people can incorporate rest seamlessly into their workday is probably what I think is one of the most promising aspects. And that is perhaps an example of something that can potentially be translated to a return to work, like, learning how people were able to do that and still be productive work from home can help us sort of think through, well, how do we incorporate that into the workday if people do return to the office?
Thank you. Thanks, Rebecca. I have a question now for Stephanie. What rights, if any, do vaccinated employees have if they do not want to be exposed to an unvaxxed colleague and their workplace? I'm going to ask you both ways. And their workplace is not mandated to have vaccinated staff, or even if they are mandated to have vaccinated staff.
So at the conference that I was at yesterday, one of the papers that was presented on, the presenter said that they had expected to see a challenge of some sort brought by immunocompromised people who were at risk because a certain environment, employer, service provider, et cetera, had let them down and compromised their health by not being aggressive enough. So the presenter said they went looking for this in case law. They went looking, expecting that this would have existed already. And so far, crickets. It hasn't happened yet from that perspective, but I'm mentioning this to answer your question because this population is the population that could prove harm. And that's an important step in terms of the rights. People talk a lot. Most of our business these days are anti-vaxxers or vaccine hesitant people calling to know, what are my rights? And all rights are balanced with obligations. And in this case, for those people who are immunocompromised, they can prove that harm. And there's a duty, that right is in the employer and service provider to protect them. That is more of a duty. That standard is higher than what's owed to regular people. Those of us who aren't immunocompromised and are double vaxxed, if the employer decides not to put a vaccine mandate in place for whatever reason, if you're fully vaccinated and you're still practicing the distancing, wearing your mask, washing your hands, there wouldn't be a lot left for you. The bottom line is that is a tolerable level of risk, and there's not really anything that you could be doing to challenge just in an abstract. If in some way an outbreak were to exist in your office as a result of that, theoretically, that would be where the challenge could come from once a harm is done. But the law never really likes to do things kind of predictively and anticipatorily. So that side of it with respect to if there is no vaccine mandate, and if there is a vaccine mandate and you're vaccinated, I kind of think that thinking about what Dr. Tam just said, it's still a really good idea to just continue to wear your mask and take your own personal precautions, knowing that in life, absolutely nothing will ever be risk-free. What you're doing is making the best choices that you can to try to mitigate your risk as much as possible. And it's the kind of the flip side of what I tell the anti-vaxxers who come to me. Nobody's forcing you to do anything. If you choose not to be vaccinated, that's your choice, but it doesn't mean you also get to choose to continue your job, choose to continue where you are. And if for you, you found it absolutely untenable to be in the workplace fully vaxxed with everything else not being to your liking, I mean, the option would potentially be to take matters in your own hand and leave, theoretically. It's not really very well established in the law, but I do anticipate we're going to see some challenges.
Thanks, Stephanie. I know that at CCRW, we have an employment lawyer who's been helping us with our vaccine policies and with navigating some rough waters. And like you said, I think you said, if you know a labor lawyer, buy them a coffee, give them a hug. And it's very, very true. I was speaking to her, I think even just this morning, and she had new information from what she provided to me last week. So it's constantly evolving, and it doesn't even just seem to be evolving in one direction. It seems to sometimes have a bit of a flip-flop. So all the best to you on that, Stephanie. I have a question next. It's probably for the whole panel, but we're going to start with Fergal. What best practices are there for establishing trust between the employer and the employee, as well as other stakeholders, when the employee is returning to work?
Yeah, that's a really good question. I think ensuring everybody has a clear understanding of their roles, and as Stephanie outlined there, like, we have rights, but we also have responsibilities. So ensuring that all parties have a clear understanding of their roles. And the other thing that I think is really important is process. So having everybody on the same page, understanding what the likely sequence of events is to be here, so that there are no surprises. People don't feel like, workers don't feel like they have something sprung on them during return to work. That communication responsibilities are clear, like crystal clear, in terms of who needs to know what, when, and through what channels. I think, from the worker standpoint, my research indicates that workers oftentimes feel frozen out of the process. They feel that a lot of communication goes on around them, not through them. And so I think having processes that bring the worker into things, like in the development of that app, for example, we're trying to work with the developers to find a way of allowing the workers to be part of that process, because the way the app was developed, it was just a channel from healthcare providers to employers. Mm-hmm. So bringing those folks into the process, I think, is really important. And I think there are ways of doing that now through technology. Yeah. So that's what I would say. Yeah.
Thanks, Fergal. I think that applies as just a best practice for everything, right? Keep people in the know, and then they're more engaged with the process. Stephanie or Rebecca, do you have anything to add to that?
From a legal perspective, also, what Fergal just said about communication, I think it's really, really important that the parties stay talking, but I also think it's important that they're talking in a positive and constructive way. And any worker who ever feels like they're in doubt, getting a consult with a lawyer to really understand the scope of what you're involved in, where you do have these rights, where you do have the obligations, to know and to arm yourself with information without even having to actually have a lawyer, but just getting that 1 hour consult, something like that, can help you anticipate, plan for, and if you do feel like for whatever reason you're not very, very trustful of your employer, it can help you know when there's a red flag or when you're still having to do something, maybe you don't like it, but it's a legitimate ask that they're having of you.
Thanks, Stephanie. Rebecca?
Yeah, I don't have too much to add except for that the trust relationship is often, again, it's, that it's come up a couple times in this panel that these things have predated COVID. It's not, suddenly COVID happened and suddenly we need to build these trust relationships. Of course, these are longstanding issues, and during any return to work, trust is paramount. So it's going back to, ensuring that we have workplaces that have healthy workplace culture, and trust all the time, so that when these kinds of issues come up, for whatever reason, workers are returning to work, that there is open communication and trust. So definitely something that workplaces are going to need to be, perhaps what COVID's done is sort of shone the spotlight on the importance of having these healthy workplace cultures with trust at all times. And maybe that's another takeaway lesson from COVID.
Excellent. Thank you. And we have another question. And Rebecca, I think that this one is for you. Knowing the work from home setup has shown inequalities, as you mentioned, and I think that is something, especially around adjustments and accommodations that happen in the workplace, but if they don't happen at home, are we further injuring ourselves? And that's not part of the question. That's my little aside. So knowing that the work from home setup has shown inequalities, possibly where we assumed it would create equalities, what can employers do to help in rebalancing that work for everyone?
I think the important thing is not to assume that everyone has the capacity to work from home. And to maybe open up that communication of like, what can we do to support you in working safely and productively during this time? And so it comes back to that open communication that Fergal's talked about, and the trust that, we were just talking about, is, having that discussion about how can we make this work? And it may need to be flexible and individualized to some degree. So not to assume that people have space that they can work in at home. And even people who have the space, you think about people who have adapted workstations in the workplace. And so they transitioned to home. Hopefully some of that equipment went home. And if their workplace is now moving to some sort of hybrid work arrangement, that, who's I mean, maybe that's a bit of a legal question, but do they then have access to an accessible workstation both at home and at work? I mean, some of those questions are things that we have been hearing from our community partners as issues that are coming up and that are going to need to be worked on. So, I think that flexibility and openness is really important.
Yeah. Thanks, Rebecca. And I think that it's very important as well that we not just assume that everybody wants to work from home, right? I think that that's something that we've kind of sometimes we don't look at that side of the coin, that that either their workplace, their home place is not accessible for working. I know that even at CCRW, we had some staff that they just could not work from home. They just did not have the setup to be able to do that. So it's important to do that. So we have one last question. We've only got 2 minutes, remaining probably 1 minute. So Fergal, it's to you in 1 minute. How can we approach the barriers you mentioned, to change management or the buy-in of looking at this more collaborative approach to return to work?
Yeah, that's a great question, because one of the main barriers is this, ego altruist sort of situation where, if I give you a bit here, that means that I'm losing something in this situation. And with the return to work situation, you see it all over the place, right? Because for an insurance agent, their problem is duration of claim, right? Their problem isn't return to work, really. I think like the interventions that have worked, Maureen, have been ones that have brought people together, and even in very simple ways. And I was really impressed with that 3-point communication intervention in Sweden, because it was so simple. Like, it was 3 meetings, and look at the durability of that intervention over time. There was nothing more than that, and they succeeded in establishing a solid sustainable return to work for those people. So I guess, you know, helping to bring people together would be my main thing, and work together, not just bring together, you know, and exchange information, talk, but actually work together. I think that is the key.
Thank you. And thank you so much to everybody. This is the end of our session, but I want to thank you, the three of you, very, very much. It's been an incredible hour and a half spent with you. So thank you.